Assalamualaikum and a very good morning to my beloved audience. I'm Maisara Subahatina Muhammad Fuzi from PHM 245A1 going to talk about my persuasive speech entitled Microdosing and In-Vitro, a step to combat animal extinction. Without further ado, let's get started. Each year, an estimated 192.1 million animals are used for science across the globe, as stated in an article published in 2022 titled Animals Used in Research Overview, provided by the MSPCA Angle Association. At some point in our lives, we have adopted an animal or can think of someone close to us with animals we care about. How would you feel if your pet bunny or even your childhood puppy was forced to consume a lethal substance till death or have their body dissected without any anesthetic or prior euthanasia? Today, I will reveal the many problems associated with animal testing and the importance of switching to alternative methods for a more promising future in cosmetics and medicine. I will begin by providing information about the animal testing itself. Numerous animals have died in laboratories. They have been tortured and experienced unbearable aches and pains throughout their life. This includes nearly 80 million experiments on animals as well as millions of other animals who are killed for their tissues used to be bred genetically modified animal strain and breed but not used. Research had been done by people for the ethical treatment for animals. PETA state each year more than 110 million animals including mice, rats, frogs and many more are killed in United States laboratories for biology lessons, medical training, curiosity-driven and cosmetic testing. Before their death, some are forced to inhale toxic fumes, others are immobilized to resistant devices for hours, some have holes drilled to their skull, and others have skin burned off or their spinal cords crushed. In addition to the torment of the actual experiments, animals in laboratories are deprived of everything that is natural and important to them. They are confined to barren cages and psychological traumatized. The thinking, feeling animals who are used in experiments are treated like nothing more than disposable laboratory. Do you know where your taxpayer money goes? In the past year alone, the National Institute of Health (NIH) used $19.6 billion to fund cruel and useless experiments on animals. This mind-boggling amount comes directly from your pocket. No matter how you fill out a tax form, your hard-earned dollars help pay for experimenters to torment and kill millions of mice, monkeys and other animals. What do taxes pay for? Your taxes support a broken system. 95% of all new drugs that are shown to be safe and effective in animals fail or cause harm in human clinical trials. Because different species react differently to drugs and disease, the result of experiments on mice, rats or other animals can't be applied to humans, and 90% of basic research, most of which involve animals, never result in any treatment or cure for humans. Because of this, statistics show that $500,000 was spent in less than 2 years only on lab animal feeding costs. Now, I have told you regarding to the animal testing effect. I will share the potential deeper action that can be taken to replace them. In an interview named Alternative to Experimenting on Animals with Dr. Charu Chandrasekera, made public in June 2022 by the Animal Justice Academy on YouTube, Dr. Charu of the Canadian Centre for Alternative to Animal Methods, CCAAM, PHM offers two main categories of animal-free methods. She oversees first-hand in vitro and microdosing. The first step she described is in vitro testing, a Greek term translated as glass and refer to examining tissue in petri dish. She regularly uses in vitro testing techniques in her lab, such as 3D bioprinted tissue models and perhaps most intriguingly organ on a chip that incorporate human cells grown in cutting edges technology. This chip successfully imitates human psychology, illnesses, and drug responses more closely than crude animal trials do. She identifies the second form in the interview as microdosing can provide vital information on the safety of an experimental drug and how it is metabolized in humans prior to large-scale human trials. Volunteers are given an extremely small one-time drug dose, and sophisticated imaging techniques are used to monitor how the drug behaves in the body. Microdosing can replace certain tests on animals and help screen out drug compounds that won't work in humans so that they are never tested in animals. Seeing as I have presented several options that can be used to replace animal testing, it is eye-opening to hear about the way each of us are impacted and these alternatives are not used in the lab. Many reasons why people microdose involve some aspects of mental health, such as reducing stress and anxiety or alleviating symptoms of depression. In a study in psychopharmacology, researchers asked people their reasoning for microdosing. 21% of people respond that they primarily use microdosing as a therapy for depression, while 7% use microdosing for symptoms of anxiety, and about 9% of people who respond use microdosing to help with other mental health disorders. Overall, 44% of people who respond perceive that their mental health was much better because of microdosing. Another study in Frontiers in Psychiatry used an online questionnaire to ask people who microdose to compare its effects with those of other treatments for symptoms such as depression and anxiety. The answers indicate that people found microdosing more effective than some other form of treatment but less effective than higher doses of psychedelics. In most cases, in vitro tests provide important information that helps manufacturers select active ingredients and develop their cosmetic formulas. Some of the advantages of in vitro testing include speed. In vitro testing method that use reconstitute human cells or skin can provide the necessary information in days or weeks. By comparison, animal testing can take months. Other than that, accuracy. Animal testing results may not always be directly applicable to human. Indeed, the most accurate way to test products intended for use on human skin is to test them on human skin. With primary human skin cells, human reconstruct epidermis, human hair follicles, or human skin explants, this is what in vitro testing offers. As you can easily see, I have told you about the limitations of animal testing and given various non-animal approaches to counteract these obstacles. We will not be able to advance toward the undoubtedly bright future that replacement techniques will bring us if we keep harming animals for human gain. As human beings, we as consumers, animal owners, and have the power to change the unacceptable way we treat our planet. Every poke, abuse, and kill animal, we take advantage of every second animal test occurs. As we speak, an innocent animal is either burned alive, cut open, or murdered without mercy. I think that's all from me. Thank you.